Okay. There's an error that occurred on Facebook. I'm told this is usually temporary. Wait a moment and then try again. Okay. I will wait a moment and then try again. And I am live on Facebook and on YouTube. So there we go.
Hi, everybody.
Hello, everybody. We are here tonight with a treat for you about, well, maybe it's a treat. It's about the Affordable Care Act, of course. Maybe we're here with a treatment for you tonight.
A treatment?
Yeah, rather than a treat. Okay, a political treatment. Okay, we're going to share for a few minutes. I'll share just for a minute, maybe.
Did you already share on Twitter, Joe?
Yes. Well, I didn't already share the link on Twitter. I shared a promo, on Twitter. So it certainly does have to be shared on Twitter. But if I know Dolores and I know Lana, probably they have already shared them both.
I hope so. Okay, I gotta go find them.
Sandy's probably already shared on Facebook. Yeah, I've got 3 shares, actually. Dolores and 2 more. Let's see. Dolores, JM Squad. There are actually 3 Dolores shares from different places.
Awesome.
Hello, Dolores. How are you? I can't remember if I shared public. Yeah, I shared it to my profile twice. So.
Okay, I don't know why you're not coming up.
Why I'm not coming up where?
Oh, they're playing with my Twitter account again. I'm not getting everything.
So what do they do with your Twitter account?
Oh, nobody sees any of my stuff unless I, get some friends to comment. And, I've got, well, I used to have 15,000 followers. Now I think I've got 14 and a half. But, I'll tweet stuff out and nobody sees it. They got to go looking for it.
So you think they're suppressing your...
Oh, I know they are. I haven't gotten a single follower count increase in almost 2 years.
That's amazing. And discouraging, of course.
It's okay. I just get more obnoxious. Sooner or later, one of these days, I'm going to say something that'll go viral, and maybe I'll break out of the algorithm.
I hope so.
Yeah, I hope so, too.
I got this Biden record group that was started for me some time ago. And actually, it dates from when he was running.
Uh-huh.
And it was very critical of him then. And it's still critical of him, I think. But I don't contribute to it very much anymore because I'm real busy doing a bunch of other things that are critical of Biden. I'm not sure quite what's happening in that particular group any longer. By the way, while I'm at this, I can't forget to share to the Red Berets.
Yeah, I was just going to say, you've got to drop something somewhere so that I can grab it.
Yeah, Red Berets, Medicare for All public group. Yeah, I'm sharing on Facebook at this point.
Okay.
Because I know our YouTube feed is being shared, and I know that we're not actually streaming to Twitter. So our YouTube feed is being shared on Twitter by Lana, okay, and by Dolores, and I'm pretty sure that the Facebook feed is being shared by Sandy, but we shall see. Okay.
I'm not having any luck finding anybody that's sharing anything, so I don't know if that's me or what that is, but I'm just going to go out to YouTube and find you, Joe.
Okay. Hey, Sandy. How you doing? Thank you for sharing. Kay says, hi, Joe, Sandy, and Dolores. And also, Dolores, I haven't said hello to you yet.
Hi, Dolores. Hi, Sandy.
Then I'll say hello to you twice. And hi, Kay, and Sandy again. Okay, I think we're ready to go. I know we don't have too many folks here. This is going to be a great stream. Everybody should be here, but I'm pretty sure this is going to be a terrific stream. So I'm about ready to really go live, take away the promo. And Lisa and I are now in full view. Full view.
Hi, guys.
Hello, we're so happy to see you. Hiya, Amber. It's great to see you too. It's always great to see you, Amber. So glad you're here. Okay, are we ready to start?
Yep.
You have to make sure that it's plugged in tight. Okay. Then you have to make sure it's turned around in the proper way because I'm still hearing it.
Well, I'll just turn it on.
Yes.
I can't keep that thing.
Right. Okay, so you want me to pull up your rant, right?
My rant? You mean my presentation?
Yes.
That's a long rant, Joe. So, let me just give some perspective. We're talking about whether or not you can make amendments to the ACA to fix the Medicare privatization.
Right. So before you go further, okay, I want to make sure that you fixed your screen so you can see this full screen.
I got it.
Okay, great. Okay, the floor is yours, Lisa.
Thank you, Joe. So, some of the things that have been coming up lately around the Medicare privatization, the direct contract entities, and the fact that Medicare Advantage and Medicare funds in general, 40% of them now have been privatized through Medicare Advantage Part C. And there's a movement now to try to unwind that privatization. And so, because I've worked in the healthcare industry and was in as a finance director of private providers who were running Medicare beneficiary programs like hospice, like home health. I've gone through this prior to the ACA and all the way up through 2 years ago when I left that profession. And I wanted to just shed some light on how intertwined the ACA was with the insurance influence that we see, and how that insurance influence was able to permeate into privatizing Medicare by underwriting insurance plans and profiting off of those Medicare dollars through Part C, which is a capitation. And this presentation is going to go through how this happened and hopefully shed some light on just how complex and intertwined the ACA, the insurance industry, the privatization of Medicare truly is, and how long this has been going on. Because of late, people have started to notice, because the generations that are on Medicaid now, or Medicare now, and coming on to Medicare, they're starting to feel the same things happening to their Medicare coverage that's been happening to private group insurance plans that we have been purchasing through our employer. It's just that the profit model has caught up to the senior population now. That is the only reason that it's getting all of this coverage. While all of us working stiffs were out there dealing with this stuff, nobody really seemed to care. But the large Democratic voting bloc is now of Medicare age or older, and it's getting its attention now. So one of the let's just start here. What influenced the ACA, and who won? So I was thinking about this long and hard today, and these are the four segments that truly had a stake in reforming healthcare. Okay, let's say that. The first one was the insurance companies that provide the coverage, providers of care who bill insurance for payments, the insurance lobbies, the what do you call them? The AMA, the pharma lobby, and all the other dark money that goes into 527 super PACs, and then from there comes lobbying. That's how that works. They go hand in hand. Okay, I'm glad you got an appointment, though. And then the last entity I'm calling Congress and the Obama administration. Congress, thus, is supposed to be representing us, right? The people. But I think that we are all very much aware of the fact that somewhere in that mix, we end up getting lost. More often now than we ever have, but we get lost, right? So when you look at these four players in here, nobody's talking about the people directly, right? You may have a few representatives on the Hill, but I think we all understand the special interests really are ruling what happens up there. Now we're backing this up to 2009, because that's when the ACA was being formed. And let's make sure that we remember that when the Clinton administration was in office, there was another attempt to reform healthcare. It was trending toward a single payer plan. Believe it or not, that was Hillary Clinton working with Bernie Sanders. Didn't happen, right? So if you remember it all, and even if you don't remember, Obama promised to overhaul healthcare when he ran. In 2000, he was elected in 2008. In 2009, they were working on healthcare reform. There was talk of drug pricing negotiations. There was absolutely talk of single payer or a public option. Single payer entirely was off the table, but there was supposed to be a public option, which would have been more like single payer, but for certain realms of people. And then, of course, we already have the insurance industry in play. At that time, America had moved away from the preventative care models that, like in the early 90s, we were on preventative care. We were starting to form HMOs. We still had insurance plans, but they were nowhere near as expensive as they were in 2009, and then, of course, what they are today. Back then, I had my daughter in 1993. It cost me $2 from the time I got pregnant to birthing her. $2. That was it, because that was what it was. That's what it cost me to get a referral into my OBGYN. Once I was in with my OBGYN, birthing a baby, all my prenatal care and birthing a baby and in and out of the hospital, no bill. Okay. We were also back then, though, like I said, more in the realm of preventative care, which meant that you went, any regular annual doctor's visits was all covered. If you had to get into the doctor because something was wrong, you went in, you paid your copay, usually $10, and they would take care of you. And there wasn't this crazy thing going on where it cost you money to go to the doctor, and unless it was an annual visit, your tests that you run or anything that you needed, you didn't have these huge deductibles. You didn't have these high deductible plans. You didn't have these, 75, 25, 80, 20 out of pocket expenditures, all of that. That really wasn't in play at the time. We moved off of that model. And let me just say that we're going to address it later on, but there are some very specific talking points that they used to try to rile up everyone to get into this thing where, healthcare is too expensive. And we're going to talk about that. But that's the insurance provider coverage. The providers themselves were finding themselves in situations where it was getting more and more expensive for them to provide care and to stay afloat as, say, a hospital system or a private provider network. They were running into struggles with being able to pay for their malpractice insurance that went through the roof. Getting credentialed with certain insurance providers, whether they were in networks or out of networks, they had to get credentialed to get into a network, to be able to take patients, all that kind of thing. So they were having issues, and they had this skin in the game. They are represented by the AMA and other lobbying groups, right? So they were a stakeholder here. The Obama administration and Congress, we were all talking about healthcare. They all ran on healthcare reform. They had a big stake in it. Some of them had their ideas about how they wanted this to go. Some of them were more concerned about the common man than others. Others were concerned about special interests. And of course, the lobby, be it the insurance lobby, the pharma lobby, however you want to package that up. There was a lot of lobbying going on at the time to ensure that whom they were representing were going to have a seat at this table. And remember, when Obama came in, his entire cabinet was very Wall Street friendly. And whether people understand this or not, and we're going to go through it, the sheer amount of money that the insurance industry aggregates is hard to even fathom. That's why the lobby is so strong. So these are the players that really had the biggest stake in the game. And ultimately, the truth of the matter is that the insurance industry won. And remember that the insurance industry puts money and creates their lobbies, and then their lobbies, influence Congress and the senators and congressmen, and that in the end influences the laws that we end up with. So let's go to the next slide, Joe.
Of course, Lisa.
So why does the insurance industry have so much money? How did they get so much influence within healthcare? So the industry designs products they sell for profit. Insurance products, right? These products insure a population based on known and calculated risk mitigation across a population. Okay, so let's just not think healthcare for a minute. Let's talk about flood insurance. I think that everybody knows that depending on where you live, some people can and some people cannot now get flood insurance. If you live in a low-lying area that is in a storm surge FEMA mapping, you're not going to get flood insurance for that property. And if you can get it, it's going to cost you literally an arm and a leg. Most people would not be able to afford it. That is the calculated risk mitigation, right? If you are in a highly prone floodplain, you either aren't going to be offered flood insurance, or if you get it, it's going to be very expensive. Counter to those people who live on top of a bluff or whatever, they're probably not going to have that much difficulty getting flood insurance, right? The chances of them flooding are zero. If they wanted flood insurance, they would be able to pay for it, and it probably wouldn't cost them all that much money per se. What insurance does is calculate the risks of them having to pay out. And when that risk of having to pay out, when that risk calculation is favorable to them, they'll sell and market that product in regions, right? So these risks are what an individual or entity insures themselves against in an effort to keep the value of their asset intact in case of an unusual event or occurrence that would diminish or destroy its value. Okay, so that's what an insurance product is meant to do. Products are sold as long as one qualifies for coverage by the premiums paid for the plan. The money is paid faithfully by the insurer, or the insurance is canceled. Most traditional insurance policies, other than health insurance, are rarely utilized, making the product extremely profitable, right? Because insurance companies aren't going to insure for something that they know is going to be a extensive loss to them. That's how they aggregate all this money. You're paying premiums hand over fist for, say, earthquake insurance. And if there's never an earthquake and you paid for that insurance 30 years of owning your house, or even longer, right, for as long as you live in that house, all that money that you gave to them, they never had to pay you for, right? And they do things, they do this with actuarials. It's extensive study to come up with what their risks are and what their rewards are. That's how they aggregate the expansive amounts of money that they have. Now, in the case of health insurance, the dynamic of utilization is not like traditional insurance per se. Everyone needs to go to the doctor. The ideal health prevention model of preventative care is to keep people healthy and to diagnose conditions early when they are treatable and manageable, which is what we used to do. We don't run that kind of model anymore. This model maintenance doesn't bode well for product profits, right? Because when you buy health insurance, it's meant for you as a human being to keep yourself healthy, right? This is where we were with health insurance back before the Affordable Care Act. People were utilizing their insurance, or were used to utilizing their insurance in the prior decade, and then things started to turn. Why? Because the insurance industry started screaming that healthcare was too expensive. Too expensive for who? Okay, it was too expensive for them because they were paying out these claims for people, and their product line, their health insurance product line, okay, was far less profitable than, say, their flood insurance product line or their earthquake insurance product line, or even car insurance for that matter, especially now because almost every state's a no-fault state. And you get into an accident and they cancel your insurance and they pay out almost nothing. And you can't, it's your fault whether somebody hits you or not. Your insurance goes up, their insurance goes up. They win. The house wins every time when you're dealing with insurance. So back in 2009, the narrative that was put out was that healthcare costs were skyrocketing. And one of the things that was being said is that people were consuming too much healthcare, right? They were going to the doctor too frequently. Seriously, right?
Oh, I remember that well.
Mm-hmm.
I remember it very, very well. They were constantly complaining about how many times people were going to the doctor to stay well.
Mm-hmm.
And
Exactly.
if they were to make a profit, they had to stop people from going to the doctor.
That you're ahead of me by like 2 steps. But yes, that's exactly what happened, Joe. They were trying to make it out to be that the American people were a, population of hypochondriacs unnecessarily running to the doctor. Seriously, that's what they were doing. So this model of maintenance didn't bode well for their product profits. The pool of money from your premiums is supposed to be profitable for them, along with paying out costs. They didn't like the profit margins on the product, literally, right? So what do you do when you're the huge insurance industry that can run all kinds of ads, lobby, use lobbyists, give them talking points? How do we get out of this? Or how do we make more money off of this? Because our margins aren't very good. Okay? You lobby lawmakers. You lobby administrations. That's
What
how you do
you
it.
try to do is get a bailout from the federal government. If you're the insurance companies and you're beginning to lose money, and it looks like as the years go by, your profit margins are shrinking and shrinking, then you start screaming at the federal government for a bailout.
Or you do what they did here and you get their attention and you allow them to write healthcare reform around you and your profits. And that's exactly what they did.
That is exactly what the Obama administration did. And I want to emphasize that very heavily. It was Obama and it was Max Baucus
Yes. Yes.
and Nancy Pelosi who bailed the insurance companies out and helped the pharmaceutical companies too. But at that time, the most essential thing they were trying to do from their point of view was to bail the insurance companies out and call it healthcare reform.
Yes.
It was going to be benefiting you. That was the narrative they were trying to sell.
I want to say something here though. They didn't bail them out. They gave them they gave them an industry. Okay? They let them consolidate themselves. And they put very little, they put pricing stipulations on reimbursements for Medicare and Medicaid, but they also allowed them to underwrite the exchange. Now remember, they were already underwriting group insurance plans. Okay. So what they basically did was give them 40% of the senior Medicare market and something that's through Medicare Advantage. Okay. So they allowed them to underwrite these plans with a capitated rate for every beneficiary that bought that plan. Okay. So not only are they getting premiums, some premiums, now they're advertising that you're not going, if you fall into the right zip code, you can get zero premium Medicare Advantage plans. I don't know how many of those exist, but
but that looks great though to you, the user, the end user. That looks great. I'm not going to have any premiums.
You're also not going to have the traditional Medicare,
right,
which allows you to go anywhere. If you want to drop everything and head over to Johns Hopkins or the Mayo Clinic or the Cleveland Clinic or wherever you want to go to get treatment, you can with traditional Medicare, right?
But you can't with new Medicare Advantage stuff.
Exactly. You're tied to a network, just like most of us working stiffs are tied to a network, right?
Right. And there's then also something between you and your doctors, and that's the insurance company. Which in traditional Medicare isn't the case.
It doesn't handle it that way, exactly. So my last question here is, so why then do we have less actual coverage in a post-ACA era and more out-of-pocket costs with skyrocketing premiums? Well, because in all of this, there was a vertical integration of healthcare by the insurance industry. It was not only the ACA that allowed that, but there were a couple of other things that happened coincidentally all at the same time. One of them was the Citizens United that passed
Ugh.
6 months after the Affordable Care Act, if that much. And there was also they rewrote some of the antitrust legislation. They took away enforcement in the Obama administration. Didn't take it away. They just subdued it. They stopped going after these industries. They allowed them to vertically integrate and look the other way, essentially, right? And this is it's all really complicated, but I'm trying to be as simplistic about this as possible. This is exactly what happened. Okay, next slide, Joe. Insurance industry gets favorable treatment in the ACA, allowing access into the operations of CMS. Now, I don't think that most people understand this, and I want to paint this as there are two different things there's many things that went on here, but there are two different markets associated with the Affordable Care Act. And depending on what segment of the population that you were in, you tend to think about the Affordable Care Act from the perspective of where you were at when it was implemented. And now that it's a decade later, some of us are cresting into a next segment of the market. But let's just be clear about this. There was group health insurance that was involved here from the standpoint of, you've got to remember now, the insurance industry was given access to underwrite with Medicare funding. That increased their profit margins, okay? The Affordable Care Act also did not stipulate any price constraints on group healthcare insurance. In other words, the common working man who was hoping for all of these benefits, because when Obama and the administration and the politicians would talk about healthcare, they talked about it under this mass umbrella, okay? So some of us, when we heard that the Affordable Health Care Act passed before everybody realized that it was garbage, everybody was excited. People heard that there were going to be pricing caps. People heard that there was going to be drug cost reductions. Well, drug cost reductions were going to be negotiated within Medicare and Medicaid, CMS. But you have to remember now, you're talking about Medicaid and Medicare, seniors, and those that are either disabled or below poverty, or it falls into I qualify for Medicaid. And there's all kinds of reasons why. Disability, all kinds. We can get into all of that. And I don't mean to exclude anyone, but what I'm trying to say herein is that depending on what segment of the population as a insurance consumer that you were in, the Affordable Care Act meant different things to everyone. Until you move into a different segment of that market, you don't fully understand what it meant, especially if you weren't in it before. You don't know what it was like before. You only know what happens when you're walking into it or when you've been in it and things change and you're like, oh, this is not good. Why are my insurance premiums going up? Or why did I sign up for this Medicare Advantage plan? I go to visit my daughter in Illinois. I fall down the stairs and break my arm. I try to go to a doctor and they tell me I'm out of network. I'm on Medicare. What's that mean? Because your brokers don't tell you that kind of thing when you sign up, when you call on the phone and sign up, right? And that's what's happening to people right now. So anyway,
They don't tell you the implications of the shift from a classic Medicare plan to a Medicare Advantage plan.
right.
They do not explain to you that you are buying into a middleman, and that the middleman is restricting your network in various ways so that you can no longer get certain kinds of treatment that you could have gotten before. Treatment which might be life-saving treatment in your particular case.
And, you know, when this stuff first started coming out, there were brokers that I dealt with, and I'm sure there are probably brokers that are out there today, but they're probably far, far fewer. But there were brokers that wouldn't sell it, and they would tell you that. They would tell you why. They would say you're much better off going and getting a good Medicare supplement, especially if you travel at all. Because if you travel and you're out of network and you get sick as a senior person, you do not want to be in that situation, right? They would tell you that. Now, word on the street is that insurance salesmen are getting incentivized for the number of Medicare Advantage plans that they sell. Okay. So it's just really important to understand that there were many aspects to the Affordable Care Act. And unless you understand this insurance environment on a level that most people don't think about necessarily or don't know about, because insurance is complicated enough, people misconstrue what it means when you talk about the Affordable Care Act versus, you know, Obamacare. Usually when people use those terms, they're talking about the exchange if you're inside, you know, or if you're trying to score political points for or against the red or the blue team, you know, you'll call the Affordable Care Act, you call it all Obamacare. There are many aspects to this. The exchange was where people could go anybody could go out on the exchange. However, if you needed insurance and you weren't qualified for Medicaid, but you know you weren't able to get into insurance plans that you could afford, or you couldn't afford it from your employer, which a lot of people fell into that situation. You could go out onto the exchange and you could buy your insurance from there, and if you qualified, you could get subsidies for it, right, through tax credits or however that works. Okay. And some people today, right now, because of some of the plans that were done, I think it was the rescue plan that Biden passed initially, they're being subsidized. They're getting subsidies for their insurance payments. I don't really remember exactly what the stipulations around it were, but they are being subsidized. So there are people who are definitely benefiting from the Affordable Care Act. Unfortunately, it was far, far, far fewer people than we were led to believe, because we were supposed to be overhauling insurance as a whole. The vast majority of us ended up in a far worse place when this ACA was enacted.
Yes, right. And we also have to remember that on the other side of the equation, the government side of the equation, well, I should say the insurance side, okay, and its relation to the government side. One thing the ACA was supposed to do was to raise the medical loss ratio, which is the idea that, okay, it gives you the percentage of your dollar that is going to medical care,
Mm-hmm.
as opposed to going to the overhead of the insurance companies or the profits of the insurance companies. One of the biggest things the Obama administration was using to tout the Affordable Care Act was that it was going to lift up the medical loss ratio so that it was going to go somewhere into the 90s. It had been somewhere
Yeah, it went the other way.
something like that. And because they've gone into the Affordable Care Act and they're doing capitation, in other words, giving a fixed number of dollars for a particular patient, you often have, well, you have a classic insurance company type, okay, of situation where if your patient beats the odds,
Mhm.
as it were, and uses less than the amount of health care that the patient is projected to use, of course, the profits of the insurance company get larger. So I don't know what the loss ratio is, okay, in terms of the Medicare Advantage programs, but I know it's not within the 90%. Okay, that
Oh
was
no, it's down, Joe. It was down
right.
into the high 70s.
Yes, into
High
the
70s.
70s. And as we'll see later, I think we're going to get into the DCEs tonight, aren't we?
I didn't really jump into the DCEs because truthfully, the DCEs were a creation of CMMI, and we're going to get into that. We can talk on the DCEs because you've done a presentation on the DCEs, so I didn't really want to reinvent that wheel, but it all ties together here. We're going to talk about CMMI and what CMMI actually is and how the DCEs come from that. But really,
I just want to say something short, okay, about the DCEs now. They are apparently being operated at a medical loss ratio of 60%. So 40% of every dollar supposedly is getting pocketed by the DCE companies, the insurance companies, and is not going to medical care.
so they're putting another layer of middleman onto it?
Oh no. In other words, if people somehow are impressed into the DCEs, okay, and usually they're signed up for the DCEs in ways that they are not aware of. So they're
Well, there's only 5 of them operating right now, Joe, and they just started. So
okay.
if they already know that they're operating in a 60% ratio, what they're doing is taking that 80% and there's another layer of middleman in there. Somebody's getting another kickback is what that means, Joe, because they haven't started operating yet. They've just started putting people into this. There's no way they have any numbers yet.
The central point here is, though, what the Affordable Care Act was supposed to do was to lift the ratio somewhere into the 90 percentile.
Never came.
Because of Medicare Advantage and now because of the DCEs, the insurance companies are creating a situation where the loss ratio is even lower and the profits for the insurance companies are even higher. And as this goes on, the so-called Medicare Trust Fund, it's not actually a trust fund, is depleted more and more rapidly, beginning to create, well, you'll soon start hearing the drums, okay, are going to be beaten, that, oh, the Medicare program, the trust fund is going to run out of money in 3 or 4 years because these private companies are draining the money into their profits. And when you start hearing that kind of propaganda, it's going to be a definite
propaganda
kind of thing. Yes, okay, it is propaganda, of course, because the government can always afford to spend what it has to spend for anything it wants to spend on. The whole Medicare Trust Fund thing is a scam anyway, which I've explained here, on numerous occasions. Okay, so I'm not going to go into it again. But the basic point is the terrorists are going to come at you again in just a few years, saying that the Medicare Trust Fund, okay, is going to run out of money and that they have to do something to raise taxes in order to provide for the financial viability of the trust fund.
Not true.
That is all going to be a scam. All they have to do is have the Congress appropriate whatever money is needed to continue to pay for Medicare. And if the appropriations are made, the payments will be made, okay, as well. One way or another, the payments will be made.
Okay, so let me read this slide because it's been up for a while. I think we've pretty much touched on a good bit of it, but I'm going to read it anyway. In the case of health insurance, the dynamic of utilization is not like traditional insurance. What I mean is it's not like traditional insurance for like fire insurance or earthquake insurance. Everyone needs to go to the doctor. The ideal health prevention model of preventative care is to keep people healthy and to diagnose conditions early when they are treatable and manageable. This model of maintenance doesn't bode well for product profits, which we talked about earlier. The pool of money for your premiums is supposed to be profitable to the insurance industry, along with paying out medical costs. You might remember the talking point of people are going to the doctor too much, which we hit on earlier. Why is the trend to provide less actual coverage in this post-ACA era and more out-of-pocket costs with skyrocketing premiums? Why is that happening? The answer is insurance profits, but I can actually tell you why. It has to do with denials. It also has to do with something that I've talked about a lot, but I'm sure people may not necessarily know what I'm talking about and often get an opportunity to answer or to ask, but something called a medical or an insurance treatment protocol. An insurance treatment protocol is literally that. Your plan is written such that, say you go in and your shoulder is killing you and you think you've got a torn rotator cuff because, guys tear their shoulders all the time, and the pain that you have when you can't raise your arm up a certain way almost always is a torn rotator cuff. Instead of certain plans will not allow you to get an MRI. The very first thing they want to do is send you off to have therapy. You go a couple of months of therapy, you use up all of the covered therapy visits that you have. If you've actually got a torn rotator cuff, it's not going to get better. You go back in, tell the doctor, yep, went through therapy, my shoulder's killing me. Oh, okay, I'll have to send you for an MRI. They'll send you. You come back, yep, you've got a torn rotator cuff. We're going to have to send you to surgery. And then immediately after surgery, you have to go to rehab your shoulder. If you don't, your shoulder's going to lock up and you're not going to have use of it anyway. What's the problem? You've already used up all your covered visits for your rehab for that year. Oftentimes, people end up having to put off the surgery until the following calendar year. When you knew when you went to the doctor in the first place months and months ago that you had a torn rotator cuff, that something was wrong, right? But your insurance protocol will not allow that doctor to give you an MRI until you've gone through 2-3 months of treatment, physical therapy treatment. They push costs of treating you out further. If you were to get that surgery in that current year, you've got to pay out of your own pocket for your therapy because it's not covered anymore. You've used up your therapy visits. That's less expense on them, right? Those are the kinds of things that happen. Or when you go to the doctor and the doctor wants to do something and it gets denied by the insurance company. Same kind of thing. There are some insurance companies that their billing protocol is to deny everything on the first pass. Now remember, it's not you that's billing the insurance company. It's your provider. It's your doctor or your doctor's office or the hospital system. Oftentimes the hospital system that's doing billing may very well be owned by the insurance company, right? Now, you would think now that doesn't really make a lot of sense. If the operation is owned by the insurance company, why wouldn't they pay the claims? I'll tell you why. because they're going to get that money one way or another. And if the insurance company denies the claims, they're going to come after you. Right? So now, not only are they not having to reimburse out of their pool of money, they get to come after you for that money. Why? Because it was denied. This is a racket, folks, a big one. And it was created, and I'm going to show you how it was created, but it was deliberately set up this way. The ACA had a 7-year implementation. It took until 2014 for Medicare Advantage plans that had existed prior to the ACA. But it really took off in 2014, which was 3 years into implementation. Why? Because the rule was written that way, tranching in implementation, because they had to gear up, they had to get ready, and then they had to deploy. Okay.
There was another reason why. Okay, and that was that they wanted to actually have the CBO project, okay, a deficit neutral situation over 10 years for the Affordable Care Act. And to do that, they had to slow down the implementation of the Affordable Care Act, so it was not actually fully available to people until 2014. Now, the act was passed in 2010, and the government immediately started collecting taxes to support the ACA from that time, but they were denying most people the benefits of the plan until 2014, which, by the way, was Nancy Pelosi's genius idea. Okay, so that was one reason why it was taking so long to implement it. We have to keep in mind here, okay, that original Medicare, without sophisticated computers, was passed, I believe, in late 1965 and was implemented in less than a year. 1966. Simple implementation. It took less than a year.
Well, it's not simple anymore, Joe. We're going to get into that. But yes, you're absolutely right. So why and how does Medicare fit into all this? The majority of insurance coverage for the ACA was thought to be outside of the age of Medicare, right? I mean, isn't that what everybody thought? That at least that's what I thought, because I wasn't in Medicare age, right? Medicare was a program that was already going, had been going forever. So how does Medicare fit into this? They privatized it. They allowed the insurance entities to underwrite plans and sell them for premiums, put people into networks, make a shitload of money off of those plans that were garbage. And they did it on purpose.
And they did it on purpose by using the Medicare Advantage thing.
Mm-hmm. Yes, they
That
did.
was the mechanism.
Can you sue anyone who did that to you as a public person?
Oh, no, it was perfectly legal.
No, they made it legal. They made the law that made it legal.
Yeah, the law that made it legal was the ACA.
Joe, they knew that there was no way that the insurance industry was going to be able to administer this more cheaply than they were. They knew it. So here's where I keep going with this. This was all the lobby. That's how this happened. We had a Wall Street friendly cabinet. We had a Wall Street friendly, hopey, changey guy in the White House. And conditions were, ripe for deregulation.
And we had a Wall Street friendly person, Liz Fowler, who was lobbying for the ACA and who wrote considerable portions of that bill because of her close relationship to Senator Max Baucus.
Yep. Yep. And I actually have that in here later on. So, did I read this last one? How did the insurance agency enable itself to start ramping up the Medicare Advantage underwriting, which privatized Medicare funding and opened the door into CMS operations? The answer is the insurance lobby, and you will see it. Next slide, Joe. Okay, so this link in here is live, Joe, but this is a picture of innovation, CMS. This is the Center for Medicare and Medicaid Services Innovation. It takes you to innovationcms.gov. And I encourage people to go here. I encourage you to go here. If this is someplace you're never going to go, I get it. But those of you who are even slightly interested in this stuff, dump out here. Take a look at this stuff. Read it and listen to it from what it doesn't talk about. Once in a while, it'll throw in better patient outcomes. But this is all profit analytics speak, period. The end. They don't talk about the artistry of medicine. They don't talk about empowering doctors. They don't talk about, innovation in profits. That's what this center is talking about here. And if you think about it in that aspect, when you get out here, it will scream at you. If you don't know what this thing is, you won't necessarily understand that what you're reading, it kind of sounds good. But if you think about it from a business perspective, is what I'm trying to tell you, this is talking about innovating profits. The center is set up for pricing, reimbursement schedules, what they're going to pay out for services, and how they're going to jury rig this thing in such a way that if you are, providing care and your outcomes for those patients aren't, what do they call them? I think they call them RV or RUVs, and they're something units of value. And I don't remember what the R stands for. But this is just all ways to come up with how do we underwrite the insurance so that we can penalize either the way the doctors practice medicine, the way the hospitals administer care, or, how do we make it so that this is an expensive way to treat this. Yes, it might be the best outcome for that disease, but this over here is way less expensive. And, for the 5 or 6%, increase in, say, total eradication of a disease, what's the cost of that? And if the cost is too high, they're going to go with the less favorable, less efficacy of a treatment because it's going to save them money.
So this is the heart of the idea, okay, of value-based care.
Mm-hmm.
When you hear value-based care, it sounds good because people, value-based care, of course, value-based care is wonderful.
Mm-hmm.
It's value-based care from the standpoint of the profits of the insurance companies. That's what they're talking about.
Yes. And I don't think people understand. CMMI has been incorporated into the Center for Medicare and Medicaid Services. They are inseparable, and they've been that way. And part of the reason that is so awful is because there are a lot of aspects of CMS that people do not understand. It's run by the insurance industries. The adjudicators of claims is run by Centene, one of the adjudicators of claims. The Center for Medicare and Medicaid Innovation, it's all insurance lobby. It's all lobbies. And that's in this presentation as well. Keep going, Joe.
Okay.
You know what? I'm sorry. If we could go back to that prior slide.
Sure.
I just want to show people something. Click on the link, Joe.
click on the link.
Right here, the blue link up at the top
Oh,
that
you
says
mean
innovation.
innovationcms.gov.
Yeah. Can you click on it or no?
It isn't active to me.
Oh, it's not. Okay, then I'm not going to be able to pull these up. Oh, bummer. Let me see if I can. Oh, that's a bummer. So these links aren't active to you at all. Okay, go back. Go back. You went too far. When did Medicare? Nope.
That one, slide 6.
Okay. When did Medicare Advantage plans explode onto the market? So what I have here are links to the actual original laws. Okay. This top one here is the, I believe that is the reconciliation one. So there were two pieces of the ACA. One went through the Congress and the second went through the Senate through reconciliation. The bill that came out of the Congress was actually most likely, although I haven't audited all of it, seems to me that it would have been more favorable. The actual lobbying happened, the hard lobbying took place in the Senate, which I think most of the time that is what happens because there's only 100 of them, right? It's easier to get at them. And it took away some very specific items associated with the Affordable Care Act and put in things that were more favorable to pricing structures, all associated with the insurance lobby. The section, if you were to go to page 12 in this document, that I thought that link was going to be live for Joe, and I unfortunately see it's not. Maybe I can pull it up. Let me see, Joe. Let me see if I can pull it up. I would just like to take people. Why in the heck? It's not working for me either. Now, why would that be? Oh, wait a minute. Click out of it. And all right, my PDF isn't coming up. Let me just pull it up through my files. If you're sharing your screen, Joe, can I share mine or no?
I can stop sharing my screen.
Okay, hold on a second.
Okay, would you like me to stop sharing my screen?
Let me just make sure I can pull it up, Joe, because I don't want to waste anybody's time. Let me just make sure I can get it. Yes, I've got it, Joe.
Okay, so I'll stop sharing my screen and you share yours.
Yes, let me find the actual page. I don't want to mess with it. What did I say? Page 12?
Yeah. Yeah, I've got to take this out completely. I've got to remove that from the studio. Okay, that's done. Okay, now you should be able to share your screen.
Let's see if I can make this happen.
Okay, what you have to do is push the share button.
Yeah, now I've got to just choose the screen. Hold on. Here we go. Okay, can you see it?
No, I can't see it. Okay, as yet, I have a question. Are you sharing a PDF?
Yeah.
Okay, if you are sharing a PDF, it can't work under the slides thing. It will just be sharing your screen. So the way you do it is you share your screen. Okay, then if it's a PDF, it's going to come under the application window.
Okay, well, the only way I know to do this, Joe, is what I was doing, and it didn't work. But anyhow, what I can do is I can just read this to you. I can try and just skim through it because it really is eye-opening. Give me just a sec.
Okay, go ahead. I will reshare my screen with the original that we dealt with. Okay, because I can move slides at least in that one.
Okay, so if you go into the Affordable Care Act, and you see that link if anybody was interested, but in section 1102, which this is the reconciliation bill, which was 55 pages long. The actual ACA that came out of Congress was 900 plus pages long. But the reconciliation has section 102, which is the Medicare Advantage payments. And it is many sections long, and it goes into 1 year transition of changes in application percentages, and this is all around how they're going to structure what those plans are going to look like, how they're going to pay out. And one thing that is interesting in these bills is they refer to Medicare Advantage as capital M, capital A, which oftentimes in CMS policy, they'll refer to Medicaid as the same, MA. So I just pointing out some of the things that are interesting to me in that they will interchange those two acronyms instead of saying advantage or something like that. They talk about application of indirect Medicare or medical education phase out. So they're phasing out indirect medical education in this. This is all under the same thing, all under Medicare Advantage. 6-year phase in of certain areas. If the difference between the application amount, this is all about pricing, in the area of for 2010 and the projected 2010 benchmark amount, as defined in subparagraph C, blah, 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 is at least $50. The benchmark amount for the area is, and then they list it out for years 2011, 12, 13, 14, 15, 16, etc. So they had Medicare Advantage build up in this bill from stem to stern. And remember now, this happened in 2000. This bill was passed in 2009. Implementation started in 2010. This was all preconceived. It's been around forever. It just ramped up.
The ACA itself wasn't passed till March of 2010.
Okay, yeah, but the bill was put together in 9. You're right.
They had to pass. Okay, both bills were passed in kind of a shared way. This was, a nifty parliamentary maneuver by Nancy Pelosi. They were able to get the 60 votes for the passage of the ACA, but not for these other items that were put into the reconciliation bill. So They took the main body of the ACA and they passed it with 60 votes. And then the part that was tricky to pass, getting 60 votes, they passed as part of a reconciliation bill.
Yeah.
And that was Nancy Pelosi's strategy, and it worked.
It's, it really is. It keeps going. Let's go down to not the next slide, Joe, or go to the next slide real quick. Okay, and this is the full bill, which was a link. So the question is, when did Medicare and Medicaid Advantage plans explode onto the market? And the answer, in short, Medicare Advantage plans got their start in 2010. Implementation expansion came within the ACA, but ramped up year over year with the big influx in 2014 and subsequent years. So we've been at 40% of privatized Medicare now for at least 3 years, and I think it's more like 4. So this is not new. It's just that the generation that is actually the Democratic voting bloc is now getting screwed. So everybody's paying attention now. That's really what happened. Next slide, Joe.
And the only way to not get screwed is to get rid of those establishment Dems, one way or another.
I mean, there really isn't any.
Either through third parties or through the strategy I've been talking about, of late. But those people have to go. It may require the destruction, of the Democratic Party. But if that's what, it requires, then that's what we have to do. Because as Kay Ryan is saying, they have created these death panels for us. They've been killing us.
It's true. Okay, so what else set vertical integration in motion? Now, vertical integration is where pharma, insurance companies bought pharma, and pharma owns insurance companies, and they own DME companies, and they own the hospitals, and they own the testing companies, and all of this stuff is all integrated into a monopoly by regions. Okay, whether it's large sector regions of the country or like regions here where I live in Pennsylvania. I'm in southwestern Pennsylvania. I've got a region with two healthcare conglomerate giants, and they are headquartered here, UPMC and Highmark. And you can have a hospital on one side of the street that's UPMC, and you've got a hospital on the other side of the street, and it's Allegheny Health Network. And if you have no control over what insurance plan your employer is going to offer you next year that you can afford. So if you've got all of your doctors that you've had for 15 years at insurance conglomerate A, and this year your employer adopts insurance conglomerate B insurance, now you can't go see your doctors. You've got to go across the street to the other doctors, and let me tell you what they're going to do. They're going to rework you up from stem to stern
And charge you for it.
because they're too damn lazy to get all of your records and go through them that way. They won't do it. So guess what that is? Expensive, right?
And
It's
some
much
of it
more
is, and
expensive.
some of it is going to come out of your pocket. And
But-
what does come out of your pocket is going to come out of the CMS pocket in some way, okay, or other.
No, not necessarily, Joe. It's going to come out of somebody's pocket, but hold on. If I'm not a senior or on Medicaid, right? Medicare, I'm on Medicare or Medicaid. That's not managed out of CMS. Okay? That's only you got to remember what CMS manages.
Yes,
Okay?
I do remember.
Okay. So think about this though. They keep screaming that the cost of Medicare or health insurance is skyrocketing, right? Who's screaming that? The insurance companies who have to pay the bills, right? The truth of the matter is, it's not costing them any more money per se to operate, because remember now, they've integrated all of this. More often than not, they own the joint, right? What they're doing, because you know it as well as I do, if you've got to go to a new doctor and he's got to work you up because you're his new patient and he orders a workup because he has to figure out what's going on with you, that's going to go towards your deductible. You're paying that, right? So this is expensive for whom? It's expensive for us.
Right. And what we also have to keep in mind here is that there is no free market.
No, there's
When
not.
we talk about going into Medicare for all, they start talking about the government undermining the free market. But Lisa has not been describing for you a free market. She has been describing for you a market that is highly concentrated and rigged in every way against you and for the insurance companies, the providers, and the pharmaceutical companies.
It truly is.
They control things. They hate free markets. They hate competition. Most business people do, whatever they tell you. The reality is they hate free markets because free markets are ultimately good for consumers. So their objective whenever they get into a free market is to destroy the free market. And over the last 40, 50 years, these conglomerates have been trying to destroy the free market, and they have largely succeeded, which means they have largely taken their own rationale for existence out of the situation. because their rationale for existence is that they're operating efficiently because they're part of a free market.
Yeah, and that's
No
bullshit.
free
That's
market.
not what it is. That's not what it is at all.
That's not what it is.
So that's what vertical integration is when they own everything. They own the hospitals, they own the pharmaceutical companies, they own, they own it all. It's part of their MCO, managed care organization, or part of their ACO, right? They handle.
Yeah, they're accountable care organization.
So unfortunately, you can't click on this link, but it is what happened to antitrust. If you Google it, it's a Robert Reich article from 2015, and Sherry Wise would be very, very articulate in speaking to us on what happened to antitrust laws. But this was just a really good summation, or not even a summation. It was an opinion piece, but Robert basically talks about how Obama came into office and said that he was going to crack down on, antitrust violations, and never did. And then laxed some of the antitrust laws at the same time. Right around 2013, I think there was a reiteration. Anyhow, it was the exact same time that allowed the insurance industry to start vertically integrating and creating these massive regional networks like Kaiser and UPMC, right? No longer is Kaiser just located in California and operating in California. They're all over. Joe, you've got Kaiser, right?
They're all over the place. They're in Oregon, okay, in Washington as well, and they're in the mid-Atlantic states, which is Virginia, D.C., okay, and Maryland.
Mm-hmm.
And they've got a very sophisticated operation there. And of course, I'm not sure they own any hospitals here, but of course, they own the doctors and they do the insurance. So that, okay, is integrated. And they have certain close relationships with certain hospitals, okay, that they really use.
Well, that's a good thing, Joe, because that's an arm's length operation for them. They must contract with certain physician networks in certain hospitals and allow you to utilize them versus, like a campus that they own. And
they don't do much contracting with outside doctors. They used to do more, and they still do some, but they have their staff doctors here. I don't see anything wrong with their staff doctors. The ones I've encountered are pretty good, but they are salary people.
Right.
There's no fee for service. Okay, they're internal to Kaiser, so they're your insurers and they're your providers, at least from the standpoint, okay, of the doctors. They have contractual relationships with some hospitals around here that are pretty close. Like, for example, the Loudoun County Hospital, they have, some floors at the Loudoun County Hospital, but the hospital they like to use the most around here, okay, is Arlington Hospital, because they managed to get some kind of arrangement with them where they've been very effective at cleaning up the hospital. So the chances of infection in the hospital at that particular hospital are a lot smaller than in other hospitals in the area. They're very careful about that. Kaiser is.
Well, that's good. That's very good. I mean, you're lucky, Joe. You're really lucky with that because you've said that you really like them. That's a good thing. At least they've treated you guys well.
Yeah, they've treated us well. They're treating us extremely well now, but they forced us into Medicare Advantage about a year ago. And we're worried. What I'm worried about is that the other shoe is going to drop at some point, and we won't have any control over that. Until they forced us into Medicare Advantage, we were paying high premiums,
Right. Right.
We were controlling the risk, basically.
Well, and you could go anywhere.
Yes, we could go anywhere, but we could go anywhere. In other words, we could, if we wanted to go to the Cleveland Clinic for something, we could go to the Cleveland Clinic. It might be that supplementary insurance from Kaiser would not cover the Cleveland Clinic part of it, but we could use the Medicare insurance for that.
Mm-hmm.
So, we could go all over the country, basically, in certain ways. Well,
But
here,
now you're in a Medicare Advantage plan. Can you still do that?
no.
Yeah, right. See, that's the thing, and a lot of people don't realize that when they get into them.
We have a network. They have good consultants at some of the hospitals around here, and we've benefited from that. So they're contracting with good people, but I'm sure we cannot go to the Cleveland Clinic. Okay, if we have to go to the Cleveland Clinic,
Right. Right.
there's a certain kind of treatment which is available at the Cleveland Clinic in Toronto, which we ought to be able to go to, but we cannot do that.
But you are lucky, Joe. You're in Virginia. You've got a lot of great medical institutions in your area, too. Although you probably can't use them either.
Well, if they've contracted
Right.
with certain doctors, we can use them. Okay,
Okay.
so for example, for some problem Bonnie had, there was a great doctor at the Washington Hospital, okay, who had access to something called a gamma knife.
Yes, I'm familiar.
And that allowed them to treat, a tumor and cut off the blood supply to the tumor. And it was a very wonderful treatment for her because she went in the morning. It was completely outpatient, the sort of thing. They gave her the treatment. We went. Also, they gave her a little bit of lunch, but that was really stupid and completely inadequate. So we went to the hospital cafeteria. We ate some sushi, and then she drove home. And she wouldn't let me drive home. She drove home. She was feeling completely great. There were no bad effects. There was a bill of $80,000 for that particular treatment, but our share of that $80,000 bill was about $100.
Nice. Nice.
So we got off very, very well in that particular situation. But we're waiting for the other shoe to drop. One of these years, the other shoe is going to drop because we know how Medicare Advantage works inside. And we're afraid that at some point it's not going to be profitable anymore to, treat one of us for something, and that there's going to be a death panel there, basically, that's going to deny us coverage. And
honestly, Joe, what's going to happen with the Medicare Advantage plan? But you see, you're in Kaiser, and a lot of people I've talked to said that they like their Kaiser. Okay, but if and Joe, I've heard that a lot, and I'm shocked when I've started hearing it. You're like, you were the first, and then I started asking, and a lot of people have said the same thing, that they're happy with it. Okay.
Yeah, right. The Mid-Atlantic division of Kaiser, that operates almost entirely independently from the Pacific Coast division. Okay.
Right.
And there are plenty of horror stories coming out of the Pacific Coast division of Kaiser. I'm not sure why that is exactly, the difference.
I think that you've got a lot of very important retired professionals in your area. I don't think it would behoove an insurance industry to treat people of that echelon and that backing, that kind of background, and treat them poorly. I really know that is part of it. That is part of it.
Yeah, it could be. And also people around here are extremely litigious.
Yeah, that's another part of it. It's true.
I should say litigious.
Litigious. There it is. There it is.
The right way to pronounce it.
Okay, so let me read this slide because we're getting towards the end.
Yeah.
what else set the vertical integration into motion? And this is an article that I've cut a couple excerpts out of, and I'm sorry the links don't work, but let me just read it to you. Drug companies pay the makers for generic drugs to delay cheaper versions. Such pay-for-delay agreements are illegal in other advanced economies, but antitrust enforcement hasn't laid a finger on them in America. They cost you and me estimated $3.5 billion a year. Wait a second. I'm sorry. Of course they're nonprofit. Oh, Johnny. Yeah. Hi, Johnny. And then he's going, or consider health insurance. Decades ago, health insurance wrangled from Congress an exemption to the antitrust laws that allowed them to fix prices, allocate markets, and collude over the terms of coverage on the assumption they'd be regulated by the state insurance commissioners. But guys, that's CACA. But America's giant insurers outgrew state regulation. They did, because they go across state lines, right? So they did outgrow it, okay? Consolidation into a few large national firms and operating across many different states, they've gained considerable economic and political power. Thank you, lobbies, right? These circumstances brought about the vertical integration of the insurance industry, taking over the healthcare providers. And next slide. Oh, I guess I didn't finish that. What else set vertical integration into motion? Right around the same time, right? Citizens United ruling. Decision on January 21st of 2010. My gosh, it was before, wasn't it, Joe? It was before the ACA. Oh my God, now this is really making sense. The court issued a 5-4 decision in favor of Citizens United that struck down the BCRA's restrictions on independent expenditures for corporate treasurers as violations of the First Amendment. The impact of the Citizens United decision in Citizens United versus FEC, the Supreme Court assessed that corporations are people and removed reasonable campaign contribution limits, allowing a small group of wealthy donors and special interests to use dark money to influence elections. Now, there's something else you need to know. 527s are super PACs. They are tax designations. They allow you to do unlimited lobbying on the Hill, straight through. The more money you have behind you in donations in your super PAC, the more attention you're going to get on the Hill as a lobby. Period. The end. That's it. And this all came about before the ACA passed, Joe, which it never registered. Who's got the kind of money to throw into a 527 besides an insurance industry? Right? I mean, they could throw and throw and throw money at their own lobby. That's what they do. That's why they're so big and so strong on the Hill. So anyhow, how corporate lobbyists conquered American democracy, which is the Atlantic. And that was a pretty cool article as well. And that's the name of it. And it's in the Atlantic. I don't remember the date on it, but it wasn't real present. I think it was a couple of years back. So they were just basically talking about what was that dynamic, right? How did the corporate lobbyists conquer American democracy? We just talked about it. You have unlimited lobbying, right? So in short, the era of the ACA coupled with Citizens United and unlimited dark money and lobbying, there was no way to stop what has happened with the insurance delivery healthcare monopolies and their control over 40% of Medicare funding. And it's also the funding coming from Medicaid, which is the Social Security Act, right? So it's not only Medicare, it's Social Security money as well. So Social Security, what do you call it? What would you call it, Joe?
It's the Social Security Trust Fund.
It's a trust fund, but it's not actual cash. You understand what I'm saying, though. It's the same mechanisms as Medicare. But it's not only Medicare that they got into.
A paper record.
Yes.
Okay, of what is owed onto the program by the Treasury Department.
Yep. So the Social Security Act is what created Medicare. The Social Security Act is also what there's monies in the Social Security Act, and depending on how things are created and written, they are privatizing Medicaid funding as well. So it's not just the privatization of Medicare. There's some portions of Social Security that are also being privatized and profited off of. So CMMI, it's not just a Trump creation. I'm sorry, I spelled that wrong. You can't click on these links, Joe?
No, they're not active to me.
Oh, damn, that makes me so mad. I wanted to pull up the Liz Fowler page. Hold on. Let me see
If you can pull out the Liz Fowler page from your end.
Yeah, let me see if I still have it open. Give me a sec. Share screen. Let's go. Window. Come on, give it to me. Let me see if I have it up, this is going to be great. I should. Chrome tab. I do have it up. Here we go. Okay. So this is the Commonwealth Fund page. Commonwealth Fund page.
Yes.
And it is talking about Elizabeth Fowler. She's the Director of Center for Medicare and Medicaid Innovation, U.S. Department of Health and Human Services.
Yeah, no? She was recently appointed by Biden.
Exactly. I'm going to read this. Elizabeth Fowler, JD, PhD, is the Director of Center for Medicare and Medicaid Innovation, CMMI, and Deputy Administrator of the Center for Medicare and Medicaid Services at the U.S. Department of Health and Human Services. So she's got more than one role, Joe. Prior to joining the Biden administration, she was the Executive Vice President for programs at the Commonwealth Fund. And the Commonwealth Fund, I have to dig into them a little better. I'm wondering if they used to be called something else and changed their name.
No, I think they have been the Commonwealth Fund for a very long time, at least since 2010. They generally do very good studies, okay, of healthcare, not just in the United States, okay, but in other nations, okay, as well. And they usually have a progressive orientation. I'm surprised that she could keep a job there for any length of time. Anyway, go ahead.
Before joining the fund, Dr. Fowler served as Vice President of the Global Health Policy at Johnson & Johnson. In that role, she focused on healthcare delivery systems and payment reform in the U.S. and healthcare systems and reform in emerging markets. Prior to that position, she was a special assistant to President Barack Obama on healthcare and economic policy at the National Economic Council, and occupied key positions at the U.S. Department of Health and Human Services, where she assisted with the implementation of the Affordable Care Act. Prior to her work in administration, Dr. Fowler was Chief Health Counsel for the former Senate Finance Committee Chair, Senator Max Baucus.
Right. And she was with WellPoint for a while, too, wasn't she?
Oh, I think that is in here. Served as Vice President of Public Policy and External Affairs for WellPoint, Inc., now Anthem, okay, and which is an insurance company, and as an attorney with the Washington law firm Hogan and Hartson. I don't know who they are, Joe.
Oh, they're a notorious firm around here. They're very, very large. They're one of the main go-to firms for people having to do with government, okay, government contracting, activities on the Hill. They're just one of the prime law firms around here that you go to when you want to get something fixed.
Mm-hmm. She also spent nearly 5 years as a health service researcher with Park Nicollet Foundation in Minnesota. She earned her bachelor's degree from the University of Pennsylvania, a PhD from the Johns Hopkins Bloomberg School of Public Health, and a law degree from the University of Minnesota. She is admitted to the bar in Maryland, the District of Columbia, and the U.S. Supreme Court.
She is really something. If there's a single person who's been more important to the course of the development of the healthcare system since the Affordable Care Act and going forward, I don't know if there's any person who has been more important than she in shaping the direction of things towards privatization and private sector domination, okay, of our healthcare system. She is the dragon lady of the healthcare system. Absolutely the dragon lady.
I'm shocked that there is so much business influence allowed in healthcare from the standpoint that they are managing it with no consideration for what is. I mean, I really look at, the artistry that is medicine, that being a doctor, you're a human being, and your relationship to another human is what makes you a good doctor in a lot of ways. Your ability to diagnose, your ability to talk to a person, to glean from them certain aspects, ask them questions, find out about what it is that might be wrong with them. If you have a doctor that doesn't talk to you, they're going to have to run more tests to figure out what's wrong with you, right? If they even get enough information from you to know what tests to run. And yet, the insurance industry is dictating how they are supposed to practice medicine, care for patients.
So there's a picture, okay, of Elizabeth Fowler there.
Mm-hmm. I'm not still sharing, am I?
No, you were not actually still sharing that, but she never appeared on my screen before. So I started to share it. In other words, I'm not sure your sharing actually worked.
I don't think it did either, and I don't know. But my system is saying stop screen share. Like if I were to hit the button, would it stop? Yep, sure did.
Right.
So, let's see. Go pull up the last slide, Joe. Can you do that?
Can I pull up the last slide? I have to. Hang on a second.
Or did we make it all the way through? We might have made it all the way through. I'm not
We did make it all the way through, but I can still pull it up quickly. And that is the last slide again.
Okay, so hold on a second. Okay, so the Center for Medicare and Medicaid Services was created back in 2010. It's been around for 11 years.
ACA. Soon after the ACA.
Mm-hmm. There have been several executive orders issued by Trump and Biden now that were directed at the Center for Medicare and Medicaid Innovation. So it wasn't just Trump. And Biden did not roll back the executive order that Trump issued. I think it's important to understand that they're supposed to come up with pricing of care, right? Value-based care, cost-sharing pricing.
Value-based pricing.
It's all business metrics. It's being driven as a profit center. That's what this is.
Yes, and Liz Fowler undoubtedly had a lot to do with writing CMMI into the bill. It may not have been created until after the ACA was passed, but it certainly is foreshadowed in the ACA bill, which Liz Fowler was instrumental in writing.
Yes.
So here
Yes.
she is. She's back again. She's back again after 11 years, and now she's the director, okay, of CMMI, in direct control of the privatization efforts that are being made actually through CMMI.
So here's my conclusion. There is no reforming the ACA. Stopping the DCEs are not likely either. And that's my opinion. But I really don't think that it's likely. We may put a pause on their implementation. But when push comes to shove, I don't see how we're going to stop them, because we've just gone through how this all came about, how long CMMI has been in place. People might jump up and down and scream, I don't want to be put into a network that keeps me not knowing it and keeps me from having traditional Medicare. But you know what they're going to do, Joe, is they're just going to price everybody out of the traditional Medicare market. They're not going to stop. This place was put in to do exactly what it's doing. This is why I get so adamant about
Yes,
this.
and it was put in place back in 2010.
Yes.
This privatization has been going on for 11 years now, below the radar of most people. The presentation you just saw now, okay, from Lisa, shows what the evolution of this system has been, and also shows how behind much of the evolution is this lady, Liz Fowler.
Yeah.
In various ways, in various positions, always pursuing the same goal, which is to privatize the Medicare system and give the profits to the private sector, and undoubtedly cash in herself with lucrative positions that she gets from time to time, okay, at various companies. It's astonishing to think she's been in back of this for so long.
She doesn't even look old enough to have done all of that. Anyhow, I'm just going to finish this and then we can talk all we want. As the CMMI function is to change the pricing structure of Medicare and Medicaid payments, there is nothing happening within the structure that the current or former administrations going back to its origin were uncomfortable with or have any intention of undoing.
Right. And by the way, that is what we would expect. And the reason why we would expect that is because all of the administrations for so long, certainly since Reagan, each and every one have been neoliberal administrations, subscribing to the religion of the market, subscribing to the fact that private business, private economics is superior to public economics, okay, and to public business. And that theme just runs through everything here. And
and if I would have been able to pull up that bill, which I'm going to fix these links in here, Joe, so that the PDFs are embedded actually in the presentation. That's what I did wrong. I linked them to the website that had the PDF on it. I wasn't thinking to switch over, but when I do that, we can clean this up a little bit and, maybe make it available in the context of the YouTube where people could actually open it up. Or maybe out on KRTD Media. Maybe that would be the place to put it so that people could see it.
the place to put it, I think, could certainly be the website.
Mm-hmm. The blog. Maybe I'll put it in the blog.
Yeah, the blog where we already have a lot of stuff.
Yeah.
In fact, we even have an article about the Affordable Care Act that was written way back in, I think, 2017.
Well, what I really want to impress upon people is I know that it looks like a bunch of mumbo jumbo. However, if you pull up the actual bill and I reference the page and you can see the section, I think it's 1202 or 1102 in the reconciliation bill that blows out not only the section on Medicare Advantage, but the changes that came about from the reconciliation piece. And then there is also a link to the site that has the two bills, Congress reconciliation, and then they have it, the conglomerated bill. It's, thanks, Leah. It is blatantly obvious in this legislation. It was written for the insurance companies. The antitrust, the lax and the stand down on the antitrust that would have kept these things from turning into regional monopolies, that was not by accident. The fact that Citizens United passed in January of the same year that allowed all that dark money to pour in overnight. When you've got the money, all you need is to put the darn structure together. Boom, you've got it. And then you just send the lobby to the hill. That all happened at the same time. It was a perfect storm. So you're not amending this thing, folks. It is what it is, the structure.
And so the only real way to get rid of it is to get a Medicare for All program, either through the state strategy that we're now beginning to follow, the fighting on all fronts strategy, or through direct action strategies that impress upon the representatives in the House, okay, and in the Senate, who are bought, and in spite of the fact that they are bought, they have no alternative but to pass a Medicare for All program. And to pass one that is in the form of a bill that excludes the kind of contracting that CMS has been doing in the Medicare Advantage program, okay, and in the DCE program. The possibility of doing that,
Not from the top down,
written out, okay, of CMS. It has to be in the new healthcare bill. And by the way, I don't think that prohibition exists in HR 1976 right now.
No, it doesn't.
I
Doesn't.
don't remember that from Jayapal's
No,
bill.
it doesn't, Joe.
I went through it from cover to cover.
Joe, it's not there. And this is the thing I'm trying to tell you. You cannot dismantle this thing from the top down with the lobby on the Hill. I know it in I'm just please don't expend your time thinking that we're going to pull this apart without starting to cut off its appendages. We're going to have to destabilize the insurance industry and show the governors and the people of the states that you can save a shitload of money not doing this crap.
Right. And that is the beauty of the through the state strategy as well. If we're successful in getting the whole Washington bill through, just in that one state, that takes a lot of business away from the insurance companies, cuts into their profits. If we do it in Washington, in New York, and in California, we cover so many people in those three states that it's going to mean economic problems for those insurance companies.
Well, and it's also going to prove beyond the shadow of a doubt that when you take the insurance industry profits out of this equation and you take the administrative burden off of the providers, you decouple healthcare from your employer, and you take that expense off of the people, the people are going to, that'll be, Joe, you won't have to dump the incumbents. People will throw them out on their ass if they don't support this.
But that's only with respect to Medicare for all, Lisa. There are a lot of.
No, it's going to save the state. It's going to save the businesses. It's going to save people from having to.
Okay, I think it's wonderful. I'm in complete support of it. But what I'm saying is that Medicare for all or healthcare isn't our only problem.
No, but it'll destabilize the strongest, first and second strongest lobbies on Capitol Hill, Joe. I don't think you're getting how huge.
No, I think I do get how huge that is, but I also know that the climate emergency is there, and the lobbies continuing to support fossil fuel use are hugely powerful too, and we have to dismantle those interests. And we have lots and lots of other problems and lots, of other lobbies. And the only way to attack them all at once is through dump the incumbents. And we need all at once. We need quick.
Yeah, we do.
Because we have 2 to 3 years. So we can walk and chew gum, okay, at the same time.
I wasn't taking pot shots that you dump the incumbents, Joe. What I was trying to do was draw the conclusions and the connections. Because when you put healthcare, say in the state of Washington, in one place, and all those claims are being paid and aggregated, all your healthcare data is being aggregated in one place, do you know what starts to happen? Let me tell you. All those people that are sick because of the Hanford nuclear site, from the contamination in the ground, in the water table, in the state of Washington, guess what happens when you aggregate all that data all in the same place? You start to see it, Joe. That's why we don't see this crap now, because the proprietary information of your healthcare is in a claim, and that claim belongs to the insurance industry. Okay? There's nobody aggregating that data. That's the other problem. The fossil fuel industry, the energy industry, all the things that are contaminating our climate, it's all being hidden because you can't see the manifestation of the disease associated with it, because the healthcare industry makes goddamn sure of it. So it's all connected, all of it. And yes, we need them all to shape up. But these things are all interconnected, much more so than most people understand.
Okay, so Lisa, I think we have come to the end of a wonderful, illuminating presentation that is revolutionary in, its implications, at least with respect to the healthcare system. So I want to thank you for that presentation.
Do you really think it's revolutionary, Joe?
Revolutionary in the healthcare context.
Well, I hope so. But it bothers the heck out of me that I spelled creation wrong. Can you please take that slide down so I'm not continually being embarrassed by the fact that I made that error?
I will get rid of that. But before we go, it's important for us to talk about what's coming up on Saturday. Okay, with Bob.
Oh, yes. Let's do that.
So what are we going to be doing on Saturday with Bob, Lisa?
We are going to be talking with him about independent media and media in general, but media that we trust, and how we're going to frame the Build Back Better Act, its passage or its failure. And our hope here is that we don't go along, independent media doesn't start to go along to get along, doesn't start to forgive and forget about the disaster that the Democrats are thus far, as far as what they've been able to accomplish and what they weren't willing to accomplish, and the fact that, whether you want to believe it or not, okay, I hear that Nancy Pelosi is a master vote counter. Listen, there's only how many? 500 of them? I mean, that's a second grade math equation, okay? When you are, when somebody says, I've got the votes, if I said to you, I've got the votes, here's what I'm going to mean by that. I've talked to everybody who's a problem, and I've sat down with them, and I wanted to know, what do you need from me to vote for this bill? Here's what I'm going to take away from you if you don't vote for this bill. Here's how I'm going to make your life more difficult as you represent your constituents
If
if
you
you
don't.
don't vote for my bill.
Okay. So who is Bob?
Joe, you always put me on the spot.
Okay. So he is Bob.
What's the name of
Henry.
what's his book?
His
I
book
forget.
is Stuck Nation.
Stock Nation. There it is. There it is.
It's change course on our history of choosing profits over people. And I believe, did he have a co-author for that book?
You know what? I don't know.
Okay, at the bookstore that I'm looking at after examining a link, okay, it's Lulu. And Lulu seems to indicate that there's a co-author. It may be that the so-called co-author here is listed because he wrote, he may have written a preface to the book. Oh, the foreword, that was it. The foreword was by Richard D. Wolfe.
Oh, beautiful. Beautiful. So he's coming on the show because we got a hold of him. He made a tweet about how we had to pass, what's going to happen if we don't pass the Build Back Better bill. You know, women need to go back to work. And I kind of jumped on him a little bit and said, please don't do this. This bill, you know, is gutted to the bones, and women, of course, need to be able to afford childcare to get back to work. But the truth of the matter is that there's some analysis on what is contained in that childcare bill and the way that it has been cut now. They're saying that it's going to actually potentially increase costs for most of the middle class because there's going to be some sort of subsidy for the lower class, or however that's going to work, right? And, you know, I just said, you know, I said to him in the tweet, please do not allow them to run on this as some sort of a success. And he actually came back and responded. And Joe followed up and said, you know, how did you put it? Do you really want to what? What was your answer?
I don't know.
You really want to get money out of politics or something like that. I'm not quite sure what you said.
Yeah, I did say something like that.
And then I said, hey, Bob, would you come on our show and talk to us about this? So he accepted. So he's coming on. And I totally forgot that I wanted to read that book, and I'm out of time.
Big business.
That's true. So anyway, Bob is going to be our guest on Saturday, the author of Stuck Nation. And one of the other reasons why we wanted to interview him is I've got this view that we are a nation who for many, many years now has been failing to adapt. That is to say, specifically, we've been failing to solve our problems. We kick the can down the road on all of our major problems. Well, let's look at, Roe V Wade.
Oh, my God, Joe, don't get me started.
Okay, at Roe v. Wade is a perfect example. The Supreme Court put through that decision in, what was it, 1973, 1971, 1972, nearly 50 years. Oh, it's going to be, Sandy, it's going to be at 9 p.m.
Yeah, same time as always.
Yeah, same time, okay, as always. In other words, I try to keep to the 9 o'clock time, okay, as much as I can, so people have a regular expectation that I'm going to be around, okay, at that time. Okay, but anyway, Roe v. Wade, for 50 years, Congress had the capability to codify it into law. It never did. And now we have this huge problem coming up, which we would not have if it was codified into law. Let's take another very, very simple thing. The debt ceiling law. It's been around since 1917. It's been clear to everybody since the 1970s that it's an anachronism. And the Democrats have gotten into power with big majorities in Congress on many, many, many occasions, and they've never had the guts to repeal the debt ceiling law. And so now, since 2010, the Republicans habitually create these debt ceiling crises to get concessions from the Democrats, and the Democrats have refused to solve the problem. By the way, when the Democrats lost control of Congress in 2010, during the period of the lame duck, they had plenty of votes to kill the debt ceiling law. They could have done it right then and there. They knew the Republicans were going to use that against them. In 2011, the Republicans had been threatening it, but they never did. And look at the environmental laws and climate emergency stuff. We knew about our environmental problems in 1970. There was a best-selling book, The Limits to Growth, sold 5 million copies, very, very popular, about the coming of the environmental problems and the eventual climate emergency we're going to have. 50 years of that. The Carter administration was very concerned with that. And we couldn't solve the problem in 50 years. How about gun control? Haven't been able to do anything about gun control for 50 years. Again, our political system does not move to solve our problems. We are the maladaptive giant. That is what we are. We're falling all over ourselves. And that's in part what we're going to talk about when we talk about Stuck Nation on Saturday.
You know what, Joe? We really have to start telling people, truthfully, we need to get in the streets. We've got to get into the streets. Yeah. It's not going to happen any other way. Yes. We've got to get in the streets. We have to. We're out of time. And what is it going to? I don't know what it's going to take. But are we going to sit here and be the frog in the pot and wait till it boils? Because we're almost there.
We're going to have to get into the streets, in order to do dump the incumbents. We're not going to be able to do dump the incumbents by simply sitting here and doing live streams.
Well,
that's not going to work.
I don't think that's going to get people into the streets, Joe. I mean, we're shooting people in wheelchairs and no one's in the streets. Cops are shooting people in wheelchairs, unloading 9 rounds yesterday or today. Is anybody in the street?
Well, maybe not, but still, we have to get people in the streets.
And we've got to figure out how to do that.
We've got to get people into the streets. So, friends, I think we have come to the end for tonight.
It was a lot of heavy work.
We'll see you back again on Saturday. So thank you, Lisa, for a wonderful program today.
Thank you, Joe, and thank you for encouraging me to do this, and thank you for helping me.
I will always encourage you to do things, Lisa.
Oh, tomorrow we're meeting with Johnny, right?
Yeah, we're meeting with Johnny at 11 a.m. Eastern Time.
Yep. Okay, good.
Okay.
Thank you, everybody, for coming.
And thank you for coming, Johnny. We'll see you tomorrow. If you're still here, we'll see you tomorrow, at 11 a.m. And you might still be here. You were here just a few minutes ago.
You're not reading comments tonight, Joe.
I didn't read them all. I put the important ones up on the screen.
Oh, you figured out how to do that.
Oh, I always knew how to do that. I just...
Didn't talk about it.
I used to do it when I first started with Be Live, but then over a period of time, I got out of the habit, of doing it, and I was reading all the comments, but when Shane pulled up the comments for us in the second episode, okay, of, dump the incumbents, it seemed to me to work well. So I thought I would try that tonight and see how it went. And now I'm really encouraged by it, actually, because it does seem to save a lot of time at the end.
Yeah, it does, except that when you're reading a presentation, I didn't read all of the comments, but I'm sure that I'm sure everybody's happy, or they would be telling us, because everybody in these chats, we know you guys. Thank you for always attending. It's actually really kind of cool.
Yeah, it's very, very cool. And the other thing that's really good about it is that so Kay, by the way, just produced a very good comment. Look at the debt ceiling, kicking it down the road till February. How many times have they've been kicking it down the road till February? And that's a pattern for them. They've been kicking it down the road till February since 2013.
I don't even know. It's getting silly.
Anyway, the debt ceiling does need to go. And we got to do everything we can, okay, to get rid of it. Sandy says, but love you all. Kay says, bye, Sandy, love you. Kay says, but love you back. Ghost Start said that was horrific, I'm sorry, in a wheelchair, cop shooting a guy in a wheelchair, unreal.
Yeah.
Well,
yeah. I mean, they've got the body cam of the cop. They're firing him. It's just, it's gross. It's unspeakable.
It's sick.
okay. Good night, all.
Good night.
We'll
Good
see
night, guys.
you.